It's now my great pleasure to introduce the Honourable Ken Wyatt, Assistant Minister for Health, to launch the report. Before entering politics, Ken worked in community roles in the field of health and education, including the District Director for the Swan Education District and Director of Aboriginal Health in Western Australia. Not only has Ken had an extensive career in health and education, he's also made an enormous contribution to the wider community in training and mentoring young people. This was recognised in 1996 when Ken was awarded the Order of Australia. In 2010, Ken was elected the Federal Member for Hasluck, an electorate southeast of Perth, and last year became the Assistant Minister for Health. Indeed, Ken's first official act in his new role as Assistant Minister last October was to launch our Can Recall app on behalf of the Prime Minister, and we're delighted to have him here with us once again to launch the report. Thank you.
I want to acknowledge Richard Vines and Kate Vines. The work that you do is outstanding. Dr. Toby Trehair, the paediatric oncologist from Sydney Children's Hospital. When I worked in New South Wales Health, I did a visit to Westmead, and the ward that had the greatest impact on me was the oncology ward, where I saw children of various ages at various stages of struggling to keep their vitality and vibrancy alive and strong. And I came out of that thinking, isn't it incredible that we have a country that is a first world country, and yet we see so many of our children experiencing the pain and grief that they go through in their families. I thank you for inviting me here today, and I'm also grateful for Tricia and Angus for sharing their story and thoughts on what is an intensely personal, emotive and difficult topic. Of Australia's population, there will be anywhere up to 42,000 people across the nation who are suffering from a rare form of cancer, individuals involved in the fight of their lives. People who suffer are not only the patients themselves, but the mums, as we've just heard, dads, sons, daughters, sisters, brothers, aunts and uncles and best mates. As a teacher, I saw the impact of a child in my classroom who was dying of cancer, but the impact on the class. It was something that I had never experienced before, but the impact was just as draining on their mates as it was on family members. This shared family strength, courage and fortitude plays a convincing part in bringing loved ones through these hardest and darkest of times. Reading your report, I know that behind each figure and each statistic, there are real stories, real lives. This is what challenges me most as the Assistant Minister for Health and why I'm doing this job. Survival rates for many rare cancers have only improved marginally over the past 2 decades. Last year's Senate inquiry into the availability of new and improved cancer drugs also helped us understand the challenges and uncover some of the opportunities to strengthen our systems. One of the most important recommendations, and I know this is the most pressing, is to address the time and expenses associated with people being able to access new cancer drugs. People who are ill must be able to access the treatment recommended by their doctor and without delay. If it can give people even just a little bit more time with their loved ones or a better quality of life, then we must make sure they have timely and easy access to the most effective medicines in a way that individuals and the community can afford. Governments exist to look out for the needs of society, particularly those at risk. We work out frameworks and systems, ways to organise fair and efficient distribution for all those in need. In terms of those people with rare cancer, it is true that some of the latest cancer medications can cost many thousands of dollars, and we heard that this morning. I know there are a handful of people in Australia who are self-funding their treatments that are not yet listed on the PBS, and some of you may be present here today. As a government, we remind ourselves the reason that PBS exists. It is so we can subsidise the most effective treatment for all Australians. New listings that are the ongoing part of the PBS. In fact, more than $1 in every 6 in the PBS goes towards cancer medications. This is why the PBAC approval process for new PBS listings must remain at arm's length, so that the government gets the best independent advice, removing the chance of government being held ransom throughout this important process. In saying that, we know there are areas where our systems need to be strengthened, simplified and modernised for people to have quicker access to better treatments. The government is considering the recommendations of the Senate inquiry and the steps necessary to strengthen the evidence-based decision-making of the PBAC, including engagement with consumers. Our PBS continues to be one of the world's best mechanisms to provide medicines. Australia's system for making medicines affordable is the envy of the world, but it is clear we need to keep improving our approach. Since 2003, funding for research in specific rare and less common cancers increased from 16.6 million to 64.9 million. A further 33 million was provided to research projects and programs which combine with the study of a rare and less common cancer types with the study of a more common cancer type. Through the government's National Cancer Control Agency, Cancer Australia, we have invested 47 million to build Australia's industry-independent cancer clinical trials. These trials include rare and less common cancers such as pancreatic, ovarian and brain cancer. The government has committed more than $2 billion in the total to cancer research since 2000 through the NHMRC Council, Medical Research Council. We invest in cancer research because together we are working towards the ideal. That is, all Australians can have a fair opportunity to live to the average life expectancy of 82 and indeed beyond, to keep people active and, if possible, involved in the workforce. Excuse me, whilst this might sound grandiose, it is something that I want all Australians to be able to aspire to. Old enough to have children, to meet grandchildren and possibly great-grandchildren. To be at those important life events, at birthdays, holidays, Christmases, first bike rides, family gatherings and weddings. So let's continue to work together to ensure there is research funding for rare cancers and to do all we can to ensure patients have access to medicines to help them live longer and healthier lives. And since I've been in this role, in working with rare diseases, I've met so many Australians who have been faced with the challenge of having their medical practitioner or their specialist give them the news that they have an illness that is not common. And often we'll say to them that there are medications that are available. And the punchline which Tanya, you referred to, was they're not listed on the PBS. And it is a telling time for any family. I want to relate an incident in which I met a cystic fibrosis sufferer who had said to me that she enjoyed teaching and she was on a new drug, and she said that her grandfather was paying for it. And in that discussion, what evolved is she called her grandfather over, and as she was telling me the story, he then indicated that he had taken out a mortgage to the tune of $400,000. She didn't realise that her grandfather had taken that step to give her the quality of life. And in that process, she made the decision for her grandfather not to fund her medication. But the outcome that I really appreciated was not long after that, the PBS listed the medication that she needed access to. And that made an incredible difference to her life. And I met her again recently. And so I know the impact that new medications have on the lives of people. But I think more importantly, we also have to consider what emotional strain and the financial and other strains that a family feels in times of hardship, because I, as a parent, and as with any parent, what we want is the best for our children. And we'll make sure that we do anything to give them the best opportunity to have a life that is going to be rich, enduring, and within the family that gives them the love and support. I want to commend those involved in writing Just a Little More Time. It's a very illuminating report when you look at some of the snapshots that are in there of people who have rare diseases, rare cancers, people who for most of their lives have enjoyed a journey of healthiness until they're diagnosed and then the change that that brings. So it gives me great pleasure to launch just a little more time Rare Cancers Update Report, which I believe should be viewed by every health professional in this nation and all of those who work within health jurisdictions, because it is in those areas that decisions are made to provide the support and to provide advice to government on the things that we need to support and fund. So I commend all of you, and let me say it is a tremendous report, and I will certainly look forward to reading it in detail. Thank you very much, Tanya and Angus.